Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral reduced hearing, and as you can see in their left ear, they have this occluding soft wax and dead keratin. It's quite medially located, so it's in the inner 2/3 of the ear canal. And on screen here, we're removing quite a sizable piece of wax and epidermal plug. So epidermal plug refers to the epidermis skin, which is the outermost layer of the skin that lines the ear canal. So it's a protective barrier that protects the dermis layer and the subcutaneous layer. In the case of the inner 2/3 of the ear canal, the bony section, you only have the epidermis layer of skin. You don't have the dermis layer and the subcutaneous layer. So this skin, as you can see, the inside of it, it's quite white, silvery. So this skin is recently shed skin. And on the other side of this underlayer, you can see it's more yellow and brown. And that's oxidized dead skin. So we know that's been there for longer. The patient's eardrum is now visible. They have got quite a bendy ear canal. So I'm just removing the skin on the anterior canal wall here, just to give me a better visual. And as I was peeling that away, you can see another layer of keratinous desquamous, which means the shed skin comes away. And now we've got this horrible, gooey, sticky, dead skin on this patient's eardrum that I want to try and remove it. The consistency of this makes it very, very difficult. So I want to actually see what's behind this yellow, sticky skin, and you'll see once I remove it that this portion of the eardrum, it's a bit more red, inflamed. It's hard to visualize the landmarks of the eardrum. So normally in a healthy looking eardrum, you can visualize the light reflex. And when we illuminate the inside of the ear, the light that we shine inside, it reflects back off the eardrum, and we call that a light reflex. We were taught when you get a light reflex, it means your eardrum's healthy, but it's not always the case. Quite often you can get a light reflex, but there's still a pathology either of the eardrum or the middle ear. So you'll see it soon, but this redness, I wasn't sure if it's granulation tissue, inflammatory tissue, because sometimes you can get granular myringitis, which I suspect it probably is. But it's almost like this outer layer of the eardrum. So the eardrum has three layers. The outermost layer is made up of the epidermal skin that I just described. The innermost membrane of the eardrum is the mucosal skin, so it's kind of a secretory layer of skin. It's a similar type of skin that lines inside of your nose. And then you've got the middle layer, the fibrous tissue. And the fibrous tissue is both concentrically aligned and radially aligned. So what I mean by that, you have these concentric rings. So if you think about, if you drop a pebble in a pond, you get those ripples. Imagine multiple ripples. The ripple in front of the next one larger in circumference and diameter. And then you've got these radially protruding fibrous tissue. So the best way I can describe that, imagine a cartoon sketch of the sun or a star and the bright lights going away from the center of the sun. So you get these protruding lines from the center going radially outwards, almost like a spider's web. And that's what gives the eardrum its strength and rigidity, at least in the pars flaccida, which is the main body of the eardrum. In the top region of the eardrum, above the handle of malleus. So when you see the hammer bone, the handle of malleus, you get that spherical portion right at the top, the bony portion, almost looks like an elbow joint. We call that the short or lateral process of the hammer bone, the malleus. And anything above that, we call that the attic or the pars flaccida. The pars flaccida still has these three layers, distinct layers, but the fibrous layer, the fibrous tissue, is not aligned in the same way as it is in the pars tensa, which is the rest of the eardrum. So that top section of the eardrum is a bit weaker than the main body, hence the name pars flaccida. So it's almost as though this outer layer of the eardrum is missing, and it's just the inner two layers, because you can almost see the rim there. You can see I'm having a good close-up. So it's very difficult to visualise the landmarks there. So we have referred this patient to their GP. I did check for, there's no pulsatile tinnitus. Sometimes when it's red at the base of the eardrum, you've got to be wary of a glomus, a tumour. So it's a vascular mass that extends from the jugular bulb. And the main signs of that is pulsatile tinnitus. So this vascular mass has its own kind of pulse, rhythmic pulse. But that wasn't the case. I ruled out any middle ear effusion, so acute otitis media with effusion, i.e. glue ear. I did that by 2 methods. I got the patient to do the Valsalva, just very gently, where they close the mouth, pinch the nose, and you blow into your nose, and that forces air to travel up your nose, up the eustachian chute. And then it can inflate and aerate the middle ear, and it causes the eardrum to bulge outwards. So if there was fluid there, that wouldn't be the case. So they were fine. And I also did a tympanometry. When you've got glue ear, your eardrum isn't mobile. So we pump air at different pressure into your ear, and we also play a sound. And we actually then measure the sound coming back. Now, if there's less sound coming back than what we've put in, it means most of that sound energy is being absorbed by the eardrum, so the eardrum is mobile. But if the measured sound bouncing back off the eardrum is equal to the sound that we're pumping towards the eardrum, so there's no net difference basically, then it means that your eardrum's not mobile, it's not absorbing the sound, so the sound's hitting the eardrum and it's reflecting back out. So in this case, there was less sound being recorded than what we pumped into the ear, which means when I was learning this at university, it's the opposite way around in your head. Like, we are measuring how much sound is being absorbed by the eardrum by measuring how much sound is being reflective, and then we subtract that by the amount of sound that we're pumping in. So in this case, there was little sound being reflected back out, which therefore means a lot of the sound's being absorbed, which means it's mobile. So there's no acute otitis media with effusion here, so it's probably just some granulation tissue there, and it's mainly on the inferior anterior portion of the eardrum, so the bottom left region and the south region there. And just mopped up as much as I can. There's a little bit left, I think, at the front bit. Yeah, so it's almost like that epidermal layer of skin is missing. The granulation tissue is causing that. And we're going to get them see their GP. I think, well, this is a bit of an older video, so they must have by now. Hopefully that's all treated and sorted. If memory serves me correct, I did ask this patient whether they were getting water in the ear, because it just had this damp appearance about their ear. You get a knack when you look inside someone's ear. You can quite often tell when they've got water, not just purely because you might see a puddle of water, but just by the texture of the eardrum and the maceration of the skin. And I think they did, so I just re-instructed them on that to avoid water getting into the ear. So guys, if you're in the US, I mean, I've read some comments over the years, but it seems as though the main method of earwax removal is irrigation. I'm just really, really surprised. And I've seen some US audiologists almost endorse that practice, which in the UK it's not. It's still performed in the UK. I'm not going to say it's not, but there are risks attached. And but I think in the US, the point I'm making, I think that's your primary method, at least when you see an audiologist for wax removal. So that's interesting to learn. I know when I went to America a few years ago on a conference, I went to an exhibition stand at the American Audiology Academy conference, and they were selling the old metal ear syringes, which is banned in the UK. So this is that little blink and you miss it moment, just a bit of dead skin here, and it just came away nice and easily. So a bit on the right, I'm not going to bother about that. That's not really significant. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.